Welcome to this week's Health and Care update about the coronavirus pandemic in Devon. While we saw a decline in cases in early December as a result of the national lockdown, over the last week we've seen that decline stop, and there's now a levelling off, and indeed the start of a rise in some of those cases. I'd like to hand you over to my colleague Simon Chant, who can give you more detail about the data. Thanks, Simon. So what this means is really, now more than ever, we need to do our bit to keep those rates from rising sharply over the next day or week. The government has just informed us we're going to remain in Tier 2 until the next review, which is the end of the year. I urge you all please to adhere to the Tier 2 guidance over the coming weeks. Now over to Dr. Paul Johnson from NHS CCG.
Although levels of coronavirus in Devon are low compared to other areas of the country, we are starting to see an increase in cases. And this has meant that people are still being admitted to hospital with coronavirus, with some being looked after in the Nightingale Hospital in Exeter, as well as our other 4 main hospitals. So the virus is still as serious as ever. So I say it every week, it's important to continue to be careful, to keep your distance, to wear a mask in public, and to wash your hands regularly. The coronavirus vaccine, you may have heard, has started, and we're delighted that it started, and it's going to be offering us a way out of this pandemic. And we're also delighted that local GP practices have begun to give the coronavirus vaccine to patients this week. They're working alongside our large hospitals in ensuring we vaccinate as many as possible of those people who are at highest risk. The people we want to get the vaccination to first are those over 80 and those who work in care homes, because they've been identified as our priority groups to get that vaccine first. GP surgeries are working in groups to deliver the coronavirus vaccine to patients, and we have 8 sites that have opened and are operating in this first phase, and they cover over a third of the county's GP practices. More local centres will be coming on board and opening in the next days and weeks to offer vaccines to even more patients. Our local communities have been hugely helpful in identifying the best sites to provide this vaccination service. So as well as using GP surgeries and health centres, some areas are using leisure centres and community centres. NHS staff are working every day to vaccinate local people in these GP centres and also in our hospitals. So I want to say a big thank you to everyone who's been involved in getting this vaccination service up and running and in delivering those vaccines to you. It helps keep you safe. You can help by helping us. It's great that so many of you want to get vaccinated, but we ask that you wait to be contacted. We know you need it, our GPs know you need it, and they will be contacting you as soon as they have the vaccine available for you. We would ask you not to contact the NHS or to your GP practice, but we will contact you when we have the vaccine ready. Also, when we do contact you, please do keep your appointments. The virus is still here, it's still serious. We do have a way out, but until that way out, make sure that you're continuing to do everything you can to protect yourself, your family, and your community.